This program is presented as part of the Spatializing Reproductive Justice exhibition, which is located in the surrounding galleries right here and is on view through Labor Day. Spatializing Reproductive Justice is a traveling exhibition and program series that aims to spread awareness of the inequities of reproductive care in the United States and the agency of design fields to expand access. Learning from past and present reproductive and sexual health justice movements, the project addresses the spatial, legal, and social logistics of reproductive healthcare access in the United States after the repeal of Roe v. Wade. This program is presented as a second part to an event first held in 2023 titled 50 Years After Roe v. Wade, Our Current Situation, a collaboration between architects and the Beverly Willis Architecture Foundation. We're excited to present this follow-up conversation with an esteemed panel who will present their work. But now I'm pleased to welcome Lindsay Harkema, one of the curators of the Spatializing Reproductive Justice exhibition, who will introduce our speakers for the evening. Thank you.
Thank you, Jesse, and thank you to the Center for Architecture and to all of you for being here. As Jesse mentioned, this is in the context of Spatializing Reproductive Justice, the exhibition that surrounds us, which broadly aims to address and normalize discussions of reproductive health, wellness, and justice in the context of the architecture profession. So tonight, our panel of guests will address the various ways that design practitioners are supporting reproductive health and well-being through practice, through administration, and advocacy within the field. So this week is the 2-year anniversary of the Dobbs decision that overturned Roe v. Wade. It has sort of amounted to what we kind of know to be a crisis of reproductive health care, impacting not just abortion, but the full spectrum of reproductive, sexual, gender, and gender-affirming health care through restricted access and options, the closure of maternal health clinics across the country, and ongoing legal threats. As I'm sure many of us are well aware, there are a constant string of legal attacks that has contributed to a kind of general state of uncertainty when it comes to the legal implications of seeking and providing essential health care. A year and a half ago, the Beverly Willis Architecture Foundation organized a panel here at the Center for Architecture upstairs in conjunction with what would have been the 50-year anniversary of Roe v. Wade. And they brought together a panel of guests, including one of the Spatializing Reproductive Justice co-curators, Lori Brown, as well as legal and administrative expertise to discuss this issue vis-a-vis kind of the architectural profession. And since it was still soon after Dobbs and soon after the overturn, I think the mood of that event was frustrated, fearful, and very much feeling the uncertainty. And we discussed with, I think, many of the folks in the room and on the panel, sort of questions around the kind of circumstances for care access and uncertainty for architects about the legal risks of designing reproductive healthcare facilities, and the general lack of discussion or acknowledgement of reproductive healthcare needs from a professional position. Today, we're still operating in the wake of these Supreme Court decisions. And in the past few months, we've seen state and federal threats against care such as IVF, abortion pill access, and we've seen studies coming out showing that the maternal mortality rate in the US, and particularly for Black women, far exceeds other wealthy countries. One of the goals of the exhibition is to, as I mentioned, sort of normalize this discussion within the profession and also extend and connect outside of the profession of architecture. And the content of the exhibition combines student research and design projects, as well as built professional work and research, and also knowledge and sort of multidisciplinary expertise from other fields, and the context about the reproductive justice movement, which was a framework that was organized and introduced by a coalition of Black women in 1994, 30 years ago, to raise a more holistic way of thinking about reproductive rights in the context of reproductive health and well-being and justice. So as they put forth in that initial definition, reproductive justice is the human right to bodily autonomy, to the choice to have children, to not have children, and to be able to parent in safe and sustainable environments. So as I mentioned tonight, we're going to be talking about different ways that architecture professionals are addressing reproductive health care in practice and through organizations that have for a long time been advocating for women and gender expansive folks. And I will now introduce our panelists. I also want to acknowledge my other co-curators of the exhibition that include Lori Brown, Brian E. Roberts, Sadie Amai, and Natalia Dickenoff of Fluff Studio. All right, so quickly, Anya Ramirez is an architect and partner at Marvel Architects, who leads both civic and affordable housing projects. And she's a board member of the Beverly Willis Architecture Foundation, who she's here to represent, an organization that seeks to acknowledge, cultivate, and value women's contributions and achievements in the built environment. Amy Garlock is an associate principal at SOM, Skidmore, Owings & Merrill, where she specializes in adaptive reuse and renovation projects. She's also a supervisor of the SOM Women's Initiative, an internal organization founded in 2011 that challenges barriers to gender equity by fostering the retention and growth of women within the SOM organization through recruiting and mentorship efforts, as well as working to support employee health and wellness in conjunction with their HR groups. Susie Gensler, oh, sorry, I'm not following the order. Sorry. Susie Gensler is a certified healthcare interior designer and design researcher at Ewing Cole and program director of New York School of Interior Design's Master of Professional Studies in Healthcare Design program. At Ewing Cole, she is her independent and now collaborative research around birthing spaces in the context of healthcare design is working to prioritize the best possible care practices and how they translate into the design of facilities. And her collaborator, Larry Jo Boone, is a design researcher and clinical expert at Ewing Cole, bringing her medical expertise as a critical care nurse to the design research. And I have to say, I met Larry Jo at the opening of this exhibition in May when we discussed kind of at length how the environment and the administration of reproductive clinics and healthcare spaces really shapes patient experience. So I'm going to invite our guests to come up and share a few remarks about how they've addressed this issue in various ways, and then I will lead a panel discussion. We'll also open it up to the audience for a Q&A. So thank you again, and Anya, come on up. I don't know if I need to. There we go. Let's see.
Okay, can you hear me? Yes, okay, perfect. So, good afternoon. I'm here representing the Beverly Willis Architecture Foundation, which I'm now going to refer to the BWAF. Okay, so I'm going to speak a little bit about the history of the organization, which was founded by Beverly Willis in 2002 as a private grant-giving foundation. Grants were distributed to scholars researching and documenting the work of women in architecture. Amongst different things that we were able to achieve early on was to create a dynamic national archive of women. But quickly we realized that around 2010, we needed to shift from research and private grant-giving foundation to a advocacy group. Okay. So in 2010, we initiated the Industry Leaders Roundtables, which is our significant conversations with women at the top of practices to help shape and reshape policies that affect and impact women in the workplace. In 2014, we joined forces and we presented here at the Center for Architecture an exhibition built by women. Additionally, in 2017, we spearheaded and currently is available the Pioneering Women of American Architecture, which you can find an archival, a scholar, really data spot to really dig into the history of women in architecture, which I all invite you to join and go. And in 2019, we inaugurated the Emerging Leaders cohort, in which we are trying to help people to continue to grow in the practice of architecture. New Angle Voices is another, adjusting to the era. We now have a podcast, which I also invite you to listen to. It's very good now that summer is here, to listen in the car and get your families involved in the stories of these spectacular women. Very recently in 2023, we opened a space because we thought that it was important to have a physical space to sort of act as an incubator for women to gather and to find resources. Today, I'm actually representing the Beverly Willis Architecture Foundation on behalf of our executive director, Tiziana Valdenebro, because we were at our leadership roundtable in Chicago. So as you might imagine, and you saw yesterday, it was raining a lot, so a few of them could not make it back to New York. So I had the honor to present this to you today. So what's happening during the course of the timeline that I just presented? Roe v. Wade is struck down. Historically, high numbers of abortion restrictions emerge, while few abortion protections are enacted, as you can see here. Politically, so-called women issues are further marginalized, even as politicians promise to support women and fight for women's full inclusion and autonomy. I want to just remind some of you, and which some of you might have been alive, but the women's rights advances are very recent. And for those that I'm sure you know, but just reminding you, we were able to start voting in 1920, which is just over 100 years ago. We were granted the right to own a company without anyone co-signing for us in 1988. We gathered the ability to get a loan without a co-signer in 1974. And we acquired the right of not being fired from our job because of pregnancy in 1978. So I just wanted to put a little bit of perspective of where we are right now. We see the obvious impact that families, planned and unplanned, have of women in architecture. These graphics from Architecture Review 2017 Women in Architecture Survey show the age of women have their first child. But we also see that a vast majority of women believe that having a child had a detrimental impact on their career trajectory. We clearly see that family has repercussions, and women have not been given bodily or workplace autonomy, and that becomes a challenge. Workplace autonomy includes many of the benefits we saw emerge during COVID, including flexible work opportunities. This graphic from McKinsey, Women in the Workplace, reports how how important autonomy is. Workplace autonomy and bodily autonomy go hand in hand. Efforts by women to participate fully in their workplace, advance policy and culture. Women spearhead conversations about equity and accessibility that benefit everyone. There goes the saying of a rising tide lifts all boats. Women's issues are fundamentally intersectional and should not be marginalized or reduced. This diagram from the World Economic Forum shows how reproductive health and material health are connected to so many areas to our society freedoms and benefits. In short, the threat to women bodily autonomy is a threat to women in the workforce. In summary, women are integral to the workforce, and BWAF advocates strongly for full and equitable inclusion in the AAC industry. But that work, as I mentioned previously, is tied to bodily autonomy and to our right to choose.
Yeah, it's important. Hi, everyone. My name is Amy Garlock. I'm an associate principal in the New York office of Skidmore, Owings & Merrill. And today I'm going to talk a little bit about the SOM Women's Initiative and what we've gone through in the last 2 years since the Dobbs decision in conjunction with our global firm-wide HR to address some of the inequities that we've just heard about and continue to live through. So SOM is a global firm, and we have over 1,300 people. And in North America, we have 6 offices, all in the US. And I mean, you can see on this map here, they're in states where the Dobbs decision has not had an outsized effect on the local regulations. But we are global, and we have people working remotely. We have people who are traveling to states, and so the impact of the decision on us as human beings is there. And so we work in this context, and architects are humans too. And so we wanted to think about how our work and our life are functioning together. SOM makes many commitments, but they are committed to their employees, and they're committed to making every employee have a great experience. And one of the ways that we do that in our offices is through these employee resource groups. And these are mostly grassroots efforts that have become formalized at a firm-wide level. And I've been at SOM for 10 years, and the growth that I've seen in the strength of these groups and the real impacts that they've had on our working experience at SOM has been really meaningful. I have been involved with the SOM Women's Initiative, which was founded in 2011, as Lindsay said, by our partner, Julia Murphy, who also is stuck in an airport somewhere. So she would have been here presenting with me, but the Women's Initiative has really been formative to my experience at SOM and to many other women like myself. And in 2022, even before the Dobbs decision, when the decision was leaked, there were many conversations about this happening in all areas of our life, but it's happening in the workplace too, because you're friends with people you work with, and you don't just talk about architecture when you go to work, you talk about your life. And the women in the Women's Initiative knew that we wanted the firm to say something about this, and we knew that there were ways that the firm's policies could address this. And specifically, a travel stipend was something that we had seen not just in the architecture industry, but in other industries as a benefit that could help offset some of the difficulties associated with obtaining reproductive care, whether it's an abortion or other reproductive care or other non-reproductive care that is denied in states where they've passed local legislation. And so in September of 2022, the partnership sent this letter to all of the SOM employees, and it was a statement that was in support of women and families. It's sort of broad, but it has specific commitment to add a travel and lodging stipend to our existing healthcare plan. And this is something that our firm-wide human resources started working on really even before the decision was handed down, and they worked with our local United Healthcare representatives. All of the major insurance companies, even before the decision was made, were working to include coverage for these services. So, this is part of a suite of care that's included in our insurance plan that addresses reproductive benefits. And so we have coverage for infertility treatment, for IUI, and assisted reproductive technology like IVF, for induction, for fertility specialists, for reproductive diseases like PCOS or endometriosis, for genetic testing, for mammograms, basic things. And we have added to this a travel and lodging benefit effective October of 2022. Use of this benefit is covered by HIPAA privacy laws, and so you don't have to let your employer know in any way that you're taking advantage of this benefit, which I think is a benefit of doing this through an established health insurance company rather than doing it separately. I know there are companies who have gone about doing this on their own, but it requires you to notify somebody who is your employer rather than your insurer. And the travel and lodging benefit that United Healthcare worked out with our insurance plan, and it's on all of our insurance plans, we have a couple different ones, is up to $2,000 in eligible travel and lodging expenses to obtain covered services outside a 50-mile radius from the member's residence, so if they're not available. And subject to the deductible, so the different plans have different deductibles, but they include airline tickets, any kind of car transportation or train transportation, parking and tolls, and a lodging amount, which is not a full lodging amount. There's an IRS cap on the per diem that I think is around $100, but it certainly would offset any lodging costs. And this is part of a larger suite of benefits, and one of the great things that our internal HR team has done around the same time that this was going on, they revamped our kind of communication of this to the overall firm. And so we have a handbook that's called Baby and Benefits. And so for anybody who's going through any kind of reproductive family event, this is a resource where all of the references for all of our resources are saved in one place. And I have a 6-month-old, so I used this very recently. And I just think it's been heartening in two ways. One is to see that advocacy at the employee level had a path to communicate to the partnership and to a large company in a way that made an impact to the choices. Certainly, in places where we have offices, this is not a controversial topic, and so it's an easy win to be supportive of something like this. But it's not necessarily given that they would go through the effort to put something like this in place. And in another way, we just heard about how recent all of the rights of women in the workplace have been won. And so something like this in place as a woman in architecture is always a great thing as you continue your career to have support like this available. So I'm not HR, but I am happy to try and answer any questions that you guys may have about this.
In what ways can the environment empower a birthing person? So why does this matter in terms of reproductive justice in the stories we share today? Maternal and infant mortality rates are on the rise globally and especially in the United States. There are maternal health that is following the same trend as an overall sicker society. Preterm births are on the rise. An increase in births in states where abortions have been banned. Labor and delivery facilities are closing as a result of the Dobbs decision, reducing access to healthcare and birthing spaces. The expansion of femtech and the shift towards personalized medical care for individuals with specific health needs prompts a discussion around how we provide reproductive justice in these spaces. An increased number of policy discussions around reproductive health are currently happening as a result of Dobbs, one of which is, I don't know if anyone's following what's happening in Florida, where they're taking the birth experience out of the hospital altogether and creating standalone birth centers that are capable of C-sections as a result of some of the angst around maternal and infant mortality. Early trends suggest that births are increasingly occurring outside of the hospital environments overall. So when we think about these stories, this connects to a broader trend of lack of access in the reproductive experience. So recentering the principles of the sister song, Women of Color Reproductive Justice Collective, we want to make sure that we understand that reproductive justice is the right to maintain personal bodily autonomy, the right to have children, not have children, and parent those children we have in safe and sustainable communities. Our focus of our research here is the recognition that although people center abortion around the reproductive justice conversation, it would be incomplete if we did not address the fact that women who give birth, particularly Black women, are dying when they do decide to have children. So this is in recognition that the reproductive justice story has to care about when we do have children and making sure that when we make that choice, we do not die as a result of it. The built environment has a strong impact on these outcomes. Supporting the full spectrum of labor and birthing experiences, such as surrogacy, adoption, masculine birth, and all other birth experiences, and understanding that we begin our communities and children starting with labor and the birth transition.
So as we had mentioned, we're kind of doing this body of research right now at UNCOL around an experience for labor and birth, which I had personally started in 2012, and my kind of thesis question was, does birth belong in a hospital if it's a natural kind of healthy thing for our body to be doing? I was questioning, do we belong in a hospital? Like, is that where we should be going for this? So I did my own survey for a project, and I had just under 400 people respond to it in 2012, and have since, this is 12 years ago, I'm now, on the research team at UNCOL, and it kind of was brought up that maybe we revisit this in light of what's been going on. And so I feel very fortunate that our team has taken this on and has reignited this work. And so we have now done another survey and have received over 400 responses to it. And it's really addressing this kind of question of where does birth belong? How can we support it?
So the questions that we're kind of asking ourselves now as designers is, how can the environment empower birthing individuals, which goes back to that idea of autonomy, to feel fully supported in addressing their needs, whatever they are, throughout the labor and birth process. What do birthing people say was supportive of their needs, and what was not supportive of their needs? These are some of the just very fundamental, basic questions that we're asking people in these surveys. What do birthing people say would make a positive impact to their experience? And then this last one is kind of like a pie in the sky. Like, how can the environment contribute to the outcomes, these really negative outcomes that we're seeing of the labor and birth experience? Our research right now is centering on literature reviews. So we're identifying how what is known about design that promotes a sense of safety, because we know that people who are giving birth are looking for a space that feels safe to them. And what is known about personal preference for labor and birth experiences in regard to their environment, what factors influence the labor and birth experience, and then also what does the CDC tell us about experience and outcomes. So looking at all of the geographic location that we can find and demographic information that we can find, and comparing that to the data that we're pulling from these projects that we're working on. And then the survey itself is really meant to understand what is positive and negative, and to relate those back to that literature. So some of our early findings, like the survey that we've just done, is so new, and we're still kind of going through all of that. We don't have all of the findings out of it yet. We're not able to make recommendations, but we thought it would be nice to have some of the early findings, and then also relate it back to what I found in the 2012 data, was kind of that this empowering birthing individuals with autonomy and decision making, which aligns very nicely with what we've been talking about in terms of reproductive justice throughout the labor and birth process. So this is for all things like pain management and birthing positions, what interventions are available, looking at making informed decisions, so talking to people about what's going to happen so that they can make decisions for themselves and for this journey that they're on. And then this is a quote somebody had said, "It was my birth. I was allowed to do or say anything and listen to my body. No one told me when to push or what position to be in. I felt empowered by it." And so really honoring that and finding ways that we can give that to everybody, right? That's the goal. So another really big one for us is looking at how we can support the clinical team. For us, the clinical team, this is kind of an aha moment for us, where we want to be supportive of the person and of the people around them, but we can't do it without our clinical team. And when we look at a lot of the write-in comments that people are giving us, so much of it, like I would say almost 50%, like don't come back and tell me I said 50%. I don't know if we're positive if it's 50% yet, because that's important when you're looking at research data. But a huge percentage of people are just saying it was the clinician or my midwife or whoever was the nurse in the room with me right after the baby was born, or who, it's that clinical team. So I'm going to ask you to elaborate on that a little bit.
Of course, exactly. And just as a practicing clinician, it's a recognition that birth occurs in the context of community, right? Birth does not happen alone. It would be unsafe to give birth alone. So it's a recognition that if we build these environments to address these outcomes, then we have to consider the needs of the clinicians who will use them. We cannot create environments that clinicians are afraid to utilize in order to give women and birthing folks the positive experiences that they deserve, beyond just survival. Creating these type of environments that encourage every participant to be prepared and safe and excited to create these birth experiences will really address some of these outcomes that we talk about when it comes to lack of autonomy, negative birth outcomes and birth experiences. So making sure that we build for every single person that encounters that birth environment, making sure that they're comfortable and confident in the work.
So we're also discovering some ideas around the environment that it should nurture and assist the care partner and family. So, we also talk a lot about this in design too, is like, where is that birth partner going to sleep? Or how are they going to be able to be of assistance? So what kind of amenities or support? We don't want this to be a hotel necessarily, but like, what do we need to do to support the people that are supporting the person giving birth, and how can we make them comfortable? We need to create adaptable environments. We hear people have a lot of options for their space, like let me lower the lights if I want to, or shut the window, or open everything and turn the lights on. Let me make it warmer or colder in my space, and provide a safe, private, and comfortable environment for birthing individuals. Again, the safe piece of it goes back to the literature review around what do we know in architecture about what creates a sense of safety, and how can we apply that? And then private and comfortable, is something that we definitely have to explore further, how we can create that. So I think that's it for us. Yeah. Thank you.
I have some prepared questions, and I have some things I'm now thinking about based on my notes. I think one thing that should be said is, like so many social justice movements and efforts, kind of the elephant in the room is that the context that has sort of given way to all of these efforts is incredibly sad, right? It's unfortunate and hugely unfair that any of these has to be seen as novel. But as we've learned from so many social justice movements, work towards liberation, begins in kind of these dark places. Someone mentioned, why this matters to architecture is because architects are women and reproductive beings, which is fundamentally true, right? But that's not always been sort of acknowledged in this discipline, and of course, in broader society. But then we've also heard about the ways that the profession, both as a workplace and then also we as designers of spaces and facilities, is directly tied to reproductive health and well-being. It's how spaces, how states have gone after abortion clinics by changing code requirements and restrictions, so they can change a requirement for a width of the door and close an independent clinic. The same way a state law that questions sort of a medical opinion can make a care provider or physician now question something that should just be life-saving care that's provided. So it's important that all of these initiatives are centering these things that on some level should just be fundamental and human, but at the same time, within architecture, a practice that is deeply interested in the spatial conditions of things that are normal and human. I think it's super relevant that we're all here. I really appreciated also, Anya, I think you mentioned the link between bodily and workplace autonomy. It's striking to me that women have not been able to own companies, within my lifetime. And I think it's important to remember that the way that sort of we kind of understand and live like freedom and sort of the ability to kind of make decisions about our personal lives really impacts the profession. So I was interested in having someone from SOM here because I knew that those conversations had been had in the past 2 years, and I think it's remarkable within a kind of historically male-driven office, which I guess you're all representing firms that are named after men, which is not uncommon, but also a celebratory moment that you are all up here representing them. But again, sort of the uncertainty that someone faces in the context of all of these healthcare threats and how it impacts your professional lives is something that is totally known by people who have experienced it and maybe less understood the further kind of you get away from that. And certainly, as we discussed at this event a year and a half ago here, something that has totally not been addressed by the profession. The link between abortion and birth, these are two things that are within a spectrum of reproductive health care that I think have been polarized completely unnecessarily by the political context. Any sort of care provider in the field knows that these two things are hugely linked, and of course sometimes you need one in order to ensure the other. And it's really interesting that one has been sort of regulated outside of the hospital environment. So abortion, even though it's provided within hospitals, public access is typically through independent clinics or Planned Parenthoods or other kinds of outside of the hospital spaces, which was a decision made at a time when they were thinking about capacity and efficiency and trying to get people the care that they need. And then the practice or care practice around birth, which is very hospitalized today, particularly in this country, and of course, for thousands and millions, thousands of years, people have been giving birth in community environments. So having sort of reflected on all of that, I think this notion of community, what that means in terms of the spaces that we design, but also the way we think about the profession is important. I've already mentioned how architects are both personally and professionally affected. I'm curious, we've kind of spoken about positive things and achievements and what's been happening. What do you see as the greatest challenges within your respective organizations or even broadly for the discipline that feel kind of most urgent today?
I can start. I have had some thoughts while you were speaking. Thank you for the inspiration. As we were talking with our administration about how to support care for women in the workplace, the conversations that we had were all very supportive and positive, but in all of these contexts, there's always a reference to what the larger architecture profession is doing. And I think the window has moved quite far, even in the last 10 years. But I think organizations like the AIA or kind of more nationally powerful places could have the power to move it further, faster, if there were some kind of standards set that firms could look to. Because I'm sure, large firms, they go to the large firm roundtable, and they compare notes. And if everybody's giving 1 month of maternity leave, they can all pat each other on the back and say, we're doing a good job, we're doing enough. But there's not necessarily people in the room pushing the collective to move that further faster. And because architecture is a profession with a high barrier to entry, right? We all have to spend a lot of time in school to get to this place. I think it tends to be a little bit insular. And so we're not worried that the tech companies are gonna poach architects necessarily, so we have to match the tech companies' benefits. You just have to match within the profession. And so I think if our national organizations could do more to push and advocate for women at a national level, I think that would be amazing to see. And we have the power to be part of those conversations.
This reminds me of actually one of the panels at the national conference this year. It was the large table, round table. And Giselle Santos Rivera, she is the global director of JEDI at HKS. She was speaking about being, I believe it was either Alabama or Arkansas, while there was some ruling from the court that it just prohibited any conversations about DEI. While she was in the state with her title, giving a talk about that. Immediately, she realized that she was an outlaw. And she brought it up to her company, HKS, a very large firm, which obviously they have, they're at the forefront of the AI initiatives. And then a conversation has started about how much you can push initiatives in practices that become illegal in some states. And that is uncharted territory. And I don't think that should prevent us from trying to push forward, but it is a legal challenge that we're living today in this day and age, 2024.
I think some of the positives that came out of it for the architectural profession has been a bigger force to enshrine and protect codes that protect access. So when we think about policies in place and code makers such as the FGI, anybody who's built hospitals are very familiar with FGI codes, really making amendments and recommendations for code that protect abortion-serving spaces. In the broader community for architects to say you cannot make rules that are different for abortion clinics that are happening in hospitals. If we can do a D&C and a D&E in a hospital, the room requirements and space requirements cannot be different than what is provided in a clinic. So I think it's a recognition that there are legal ways and efforts to protect and ensure that in the codes, in the actual architecture profession, you have a guide that says, I can't actually do this. There are ways to protect folks who need these services. So I think that's one of the positives.
I think one of the hurdles is going to be funding, and like if we're talking about extracting birthing out of a hospital setting and putting it into a birth center plus type environment within our communities, it's going to be really hard to pay for those because it's going to have to be an incredibly, somebody's going to have to really want to invest in that model because it's going to be very expensive to build it. And your reimbursements are typically not great for labor and delivery practices within the hospital right? So like our clients aren't making all of their money in this. So I think one of the hurdles is really going to be around how we big picture could create something that is self-sustaining, that would provide that medical care and intervention that is needed. I also think another hurdle is going to be our mental, cultural context around birthing needing a medical intervention because our infant and mortality rates are so high. But it's this like chicken and egg situation where, the data shows you that the more C-section interventions that we have, the higher our negative outcomes are. So if we're so afraid, we're going to keep wanting to be in that safe space where we have access to that medical care in the event that we need it. So it's this like chicken and egg situation where we're going to have to fully shift people's perspective around, where this can happen in a safe space, and then be a supportive situation for them.
Safe space is such an incredibly kind of powerful concept. What does it mean to be a safe space? For someone seeking a certain kind of care in a hostile environment, the safe space for them is probably a space that's willing to kind of enable them to receive the care that they need, and at the same time it might be one of the most threatened and kind of most restricted kinds of spaces. The idea of a hospital being a safe space, and yet data showing that the kind of mortality rates are going up. It's now increasingly a space where the best possible care is not totally insured because of legal obstructions. And even the idea that the kind of workplace and the profession that you're operating within is a safe space, I think is something that we would strive for, but is not always true. And knowing that the history of the architecture profession has been predominantly male, white, upper class, and then yet we kind of strive to design spaces that are equitable for everybody. I think it's important to know that idea of what is a safe space is something that is kind of relative, right, to your individual experience. I wanted to ask a little bit more about the design research that you are doing, also in the context of like different environments, if there's a particular project or a particular place that you are thinking about, or if this is kind of holistic research. You mentioned in Florida as an example, there is a move to kind of take birthing out of hospitals kind of in response to what's been happening there. But the question of what it means to design spaces for reproductive care in very different legal contexts, I think, is something that has been a question for 2 years since Dobbs, something that Lori Brown did right after the Dobbs decision was ask architects to kind of put their names on the list if they'd be willing to work on abortion clinics or design abortion clinics in unsafe space or unsafe states. So how much, and maybe this is or isn't relevant at the level or where you are in the research, but how much are you thinking about like the context of the broader context of the birthing space beyond sort of the hospital and at the kind of social societal level?
I think, as it relates to the project that we're currently working on right now within the research, data that we've compiled and the literature review that we're doing, it's pretty centered at the moment on creating like a labor and birthing environment. Is that the question?
Yeah.
Okay. So, but I think that we're kind of looking at other models that are out there that are starting to show some of the really beneficial outcomes of pulling viable labor and birthing situations out of hospitals and into birthing centers. which is showing, what we're seeing is that there's one in particular, yeah, the one with 0 mortality rates.
So when we're looking at these environments, the environments that have really divorced themselves from the hospital setting, and particularly the ones that are owned and operated by Black women, have had significant impacts on mortality for Black women who give birth there. And so a lot of our research is around investigating whether when we pull these environments out, not only do we divorce ourselves from those high medical interventions, we also want to recognize that there's a cultural component that's necessary to be able to create safety. So you spoke earlier about the need to create safe space and what safe space looks like for folks. A lot of our work continues to center around safety looks different to everybody. Right? Some people may feel that a hospital is safe. They may feel like they want to have access to higher intervention care. They may have more anxiety around being in a low intervention space. There's also recognition that even in those spaces, folks that look like me are not given the autonomy of someone that looks like Susie. And so our research centers around the recognition that if we're going to create spaces that allow people to survive and thrive, then we have to have those cultural considerations of not just the built environment, but who's serving them and who's listening to those voices. Because we know how often those voices from folks who are not at the center of society are ignored. So we continue to try to build on those particulars of what serves someone who's queer, what serves someone who's non-binary, what serves someone who comes from a more impoverished background, and ways to affirm and empower their decision-making and inform the providers who will be in those spaces, the things that they need to do to provide a full spectrum of reproductive justice for them.
Mm-hmm. This connects a little bit to, I think, the resource groups that have been started at SOM, but I'm thinking about, I think you mentioned the grassroots organizing that happened within the firm to create the resource groups. There's a number of them beyond the women's group. And so you're speaking to the point that in the context of reproductive health care and birthing, we know that there's inequity along sort of race, class, gender, all of these lines. Yet, of course, everyone still is having reproductive sort of medical experiences. In the workplace, in big firms, we still don't have a population that matches necessarily the general population. There's greater representation, and the fact that, of course, like advocacy groups within firms and within the profession exist, have been started by representatives of those groups, speaks to that. At the same time, I think we don't necessarily think of SOM or any architecture firm as like the most diverse place. So I'm wondering if you can speak about like how like who or how efforts for like really groups that are not fully kind of represented or like how all of that has been handled and how that organization kind of works to empower them.
Okay, I'll do my best.
You can speak mostly about the women's
No, it's a hard question.
too.
Well, I think it's an important question. I think, we're a large firm, and I think that gives us a certain advantage, both in terms of resources and just the size of the pool of people who are there. I mean, we have over 300 people in the New York office. I'll just speak to that experience because that's what I know the best. And about half of those people are women. It's certainly not equally distributed across different departments and across levels within the firm. But there's a lot of people there, and everybody comes with a different background and a different path to getting there. And so there is some diversity of voices and experiences there that we can draw from in the room, relative to, like, you know, I've worked in an office where it's me and 2 other people, and I'm the only woman, and so that is a harder situation to find yourself in. And so I think certainly we are trying to, you know, hire new people into our firm from a diverse background in order to continue to get new perspectives that will just enhance the quality of our work and the quality of our workplace. And so I think as we've been doing that, and as you see changes in who's coming up in the profession, I think there have been meaningful changes in the last 10 years in our workplace because of the people who are the new generation of architects who are coming into the workplace and demanding that their working conditions reflect, you know, the respect for them as a human being. And you know, I'm a millennial, and we're not even that great at it. We're doing it, but like Gen Z is coming, and they're like, "You guys are not doing this well enough. You have to advocate more forcefully." So I think we are learning from our younger colleagues, and we also are learning from what we see both outside of the architectural profession, in other workplaces where you have even larger or more diverse pools of people, and we're learning from what we see in the academy. You know, of course, the academy is going to be more forward-thinking than a corporate architecture firm that existed for like almost 40 years before Roe even passed. We've been around for a long time. And yeah, I think in a place that's an institution, which is how I kind of see SOM and other large firms like your own, it's a place that has many generations of life, and I think we have to continue to push places like that to not just keep up with the times, but to move forward and kind of be a place that matches the reality of living and working in this time and makes it better. Yeah, I don't think I can adequately address the like diversity in architecture question in this response,
Oh, yeah.
but we'll have a panel for that another time.
That's totally fine. I think kind of the comment about sort of grassroots self-advocacy, younger generations sort of moving sort of or advocating for their own needs as a way to kind of push change within the industry is something recent. It's also something that is very much the foundation of the exhibition, which is mostly student work, which I think I can confidently say the representation within the student groups that made the work that you see is very different than kind of the profession at large, and that's a kind of open question for architecture about how we maintain that representation that we do see in schools, you know, through the profession and mentor and empower folks. But, you know, the students were not at all hung up on sort of the legal threats, or, you know, we're not at all, as kind of hesitant, of course, because they were in the academy, but also because they were kind of coming from a place of, you know, none of that matches kind of my own experience and what I know to be true. So it's, I think actually the things that the students were thinking about are very close to some of the things that you were speaking about in your research in terms of what spaces that match kind of the best possible care practices could look like.
Can I add one small
yeah.
thing, actually? so I'm calling these employee groups grassroots efforts, and that's true in a sense, in that the kind of initiative to organize and meet and advocate came from the employees. But something that was a huge part of the organizing effort was actually getting the power structure to find, like, to even have a space, talking about space cases, but a space and a time to receive the feedback. And so if you or someone you know is in a position of power at an architecture firm, even if there isn't an organized effort, I think making a space for employees to tell you what they need to feel supported in the workplace is really critical. If the space doesn't exist, then there's no pathway to even hear it in the first place. And so trying to talk to people to get those spaces, basically we got a committee to exist where partners were open and receptive to hearing the feedback from these groups, and it's been, I think, monumental in changing the way that employees have a conduit to communicate their needs to, like, a private partnership, which is what most architecture firms are, or a single practitioner even.
I want to give some perspective because it sounds like this is all been happening all along, but that's not true. Beverly Willis started this organization 2002. There was no conversations about women in architecture and construction and engineering back then. And it might sound, for some that have started the profession like 10 years ago, that this is all being all along here, but in my almost 20 years of practicing, this is happening now. These conversations were happening in small groups. Now it's more visible. There's more women in leadership. Recent research shows that the top architecture firms, the leadership of women are around 25% to date, and we have a long ways to go. But we're getting there. Just wanted to bring that a little bit of that perspective. And as I mentioned in my presentation, women are like sort of leading the path for other minorities, more conversations about diversity. And like I said, if women continue to make success and progress, clearly others are going to continue to make progress in those topics.
I think in a minute I'm going to open it up for questions from the audience. This isn't really a question, but just kind of reiterating something that has been mentioned a few times. One, how insular architecture as a profession can be, that in some ways has sort of contributed to this context, but how much is necessary to look outside of the profession in terms of examples of maybe other sort of disciplines or professions that have made achievements, in any of these areas, but also in terms of just the disciplinary knowledge and expertise and the personal lived experience of humans using the spaces that are designed, how essential that is to all of this. And one of the things we thought about, particularly for this event, was addressing the profession of architecture. We're in the Center for Architecture in the context of AIA New York. But ultimately, this is a conversation that cannot be housed within this profession, and it needs to connect outside of it. Part of the reason behind the exhibition was to obviously kind of show how this is relevant within the profession, but it's also mostly about conversations and learnings from outside, which I think has been kind of underscored in the conversation. Questions from the audience? We have a couple of floating
Can I just add to that real quick?
Yeah.
So a lot of what we talk about in our research is around this idea of the disability justice movement and the nothing about us without us. and how whatever we're doing, and it relates to our hiring practices within the architecture firm. It relates to when we're doing a design for a project. The built environment and our workplace is only going to be better if it is an incredibly diverse situation and environment for all of us. And when we've done also another research project specific to disability design, and we could never have done that without making sure that people who identify as having a disability were part of that work. So I think the same goes for when, if we're hiring in our architecture firms and our design firms, we need to be making sure that we're bringing people on that represent the full spectrum of people, right? And I think that I just wanted to add that to that conversation.
Thank you for such a great presentation. I guess part of what I gather is that hospitals, for example, as a birthing place, are kind of mainly are failing women of color, Black women, et cetera. And I guess the question is, and there are other venues that could probably serve birthing and community better and other reproductive health as well. And funding was mentioned as a barrier. And someone who works on public buildings, where does government come in? We build police precincts, we build firehouses, these are all things for safety. Why doesn't this fall under the umbrella of safety? Why aren't these public buildings that can be Department of Design and Construction could build, or health and hospitals can build? This is a health issue, it's a life safety issue, it's all these things that no one else bats an eye when you're building some other type of public infrastructure or building. So how do we advocate for our tax dollars to pay for these things? How do we advocate this is something that's needed for the city as a whole, right? So, thank you.
That's a great question. Why don't we build more of these spaces? I think a lot of it has to do with the recognition or the idea that hospitals are providing quality care. Although there are issues that are surrounding maternal morbidity and mortality, the people who are affected in higher proportion, BIPOC folks, Black and Indigenous folks in particular, are people who are usually considered outside of the conversation. People who live in historically divested environments are more likely to get resources like policing versus healthcare, because that's considered something that they need from a deficit perspective and never about a wellness perspective. Ways that we can improve. How do we advocate? How do we get these things into our spaces? For those in the architecture and design space, civic planning, urban planning, and ensuring that we have conversations about what healthcare amenities are being brought in and what are the populations that are experiencing these disparities, what are they asking for? If at this point in time we know that Black women are so afraid to give birth in a hospital that they're giving birth at home, that they're giving birth in a trailer next to a hospital, we have to ask those people directly what it is that we can do to put in your community that will allow you to feel safe and cared for as a health amenity. Outside of the traditional model, what can we do to amplify your voice? And lastly, speaking to that advocacy piece, call your senator. Call your congressperson. There's the Momnibus Act that is out right now. It's one happening in Detroit. In the state of Michigan, there are acts in New Jersey, all trying to get passed to say we need to cover doula care, we need to cover extended maternity leave, we need to make sure that when we address these issues, we cannot leave Black women outside of these conversations because they are so disproportionately affected. So when we talk about these things, there's so much civic power, and you just have to show up and talk to these folks and say, this is what we need when you build a space. We have to build these things in to protect these folks.
Yeah. I mean, the Dobbs decision is not an anomaly within the United States government. It's reflective of the kind of lack of attention to care for women that our policies reflect. The United States is the only industrialized nation without guaranteed maternity or paternity leave. I mean, it's really crazy, among other things.
I think also this question about sort of public spaces, public institutions, public environments, and public funding, so much of our built environment is shaped by the blurriness between private and public, and what forces are actually shaping even things that we kind of think to be public. The idea, along with the idea that a hospital is a safe space, is the idea that it's an accessible space, or even that in New York, or in a context that is relatively liberal, that you will be ensured the best possible care. Of course, most of our hospitals here and across the country are private and are associated with religious organizations or Catholic hospitals, which technically have in their sort of code of conduct the kind of right for the church to be deciding how care is provided. And I think that's, of course, something, again, sort of to address maybe in many different ways. But I think generally kind of the awareness and the kind of discussion of this, in public, we know that our public spaces, many of our most kind of cherished public spaces here in New York, are ones that have been enabled through private funding or private partnerships. And that speaks to a kind of crisis of public funding on many levels. And as architects, we don't always have sort of the power to kind of have a say in shifting that. But at the same time, I think we're in the room and we're engaged sort of at various levels with the processes by which many of those partnerships are being made. So it's something to consider. But that was a fantastic question and great answers. Other questions?
Hi, is this on? Oh, yes, it is. Ooh. So my question, I have so many questions, but I'm going to ask this one. How do you open up the conversation between A&D firms and clients? And the reason I ask this is when there's anything built or anything upgraded or redesigned that targets women and their health, it's very segmented. So it's either a birthing center, or it's an abortion clinic, or it's an oncology suite, but it's never addressing women's health as a whole, right? The moment you're born and it's determined that you are a girl, and that is your gender, the health that you have access to is predetermined, right? So I can speak as a woman. I don't know the difficulties that I would face if I were non-binary or if I were trans. But these are issues constantly that I think about when I'm a designer working on the client side. These are things that I think about when we're having conversations about centers for women's health, but it's very, very segmented. And even in this conversation, which is a great conversation, we're not talking about access to birth control. We're not talking about, access to GYN care for preteens. We're not talking about, I was just reading the other day about how girls are entering adolescence, puberty, earlier and earlier, having their periods earlier and earlier, which is frightening, because it was scary and I was 14. So how do we open up these conversations? How do we open this up?
To add to the list, sex ed standards.
That's why I said I had a lot of questions.
across the country, but in New York City, again, the assumption that this is a liberal context. Our public schools have very poor sex ed standards, like so many places. It's one of the many factors that contributes to this.
I can jump in, but do you guys have anything that you want to say? Okay. I think that it's those initial meetings where we look at a scope of a project and we make sure that at the very beginning of our project we have the right people on the team that is reflecting the diversity of the project, and that people, and I don't mean to like self-promote, but I will, like, people who are on the research side and who are looking at trends and big picture from a design perspective are at the table too, because I think that it helps with navigating those conversations of what are all the possibilities, and it helps facilitate because I mean our job is to ask questions, like we want to find all the nooks and crannies of how we can design a space with the best possible outcome for the people who are going to work and be cared for in it. So I think from that perspective, like when we get to be on a team together with our planning partners and our architect partners and our interior designers as design researchers very early on, then it allows us to kind of help shape the conversation around what could this be, like you saw when we put on the idea of the birth place needing to accommodate masculine birth and surrogacy and adoption. Like, if we consider all the users within a space and identify all of the potential needs, that's really going to change what that labor and delivery department is going to look like. Like if we have a surrogacy situation, there's two families now, and how are we addressing both people? There's a birthing person, and then there's the family. Like, what are their needs? How can we shape the environment for all of the needs of that space? So I think it's really about that, like those really early conversations with our client partners to say, how can we build and shape these environments to support all the people that are going to be in this space?
I think I can address your question from a different perspective, from the perspective of somebody who's using all of these different kinds of spaces. I think there are people who are trying to address the fragmentation that you talked about, and that's immediately perceptible anytime you step into like the United States healthcare system. But I think the solutions that so far exist are hard to access, and they're coming from the private sector and from tech. I know SOM just made available to all of its employees a service called Maven, which is a women's health startup that is basically an advocacy. They give you an advocate who can help guide you through either a birthing process or any kind of like women's health issues specifically. And it includes also postpartum care. So that seems like it's a company that's trying to do that, but obviously the reach of something like that is going to be limited to people whose white collar job can pay for their access to that, or who have the resources to access that themselves. So making something like that more broadly available would be amazing, and I think that has to come through kind of organizing and calling your senator. I don't know. I'm not immediately hopeful, but it's something to work towards for all of us.
Architecture is trying to solve, existential problems through tangible spaces, which, I mean, is laudable, but it's almost impossible. There's a lot of advocacy that needs to be done, and yeah, it starts at politicians who want your vote. So we are in a place that there is a majority that somewhat agrees, so there's really no big shifts. But regardless, at the local level, there could be some impact. All these representatives do go to Congress and represents a smaller group of people. And sometimes we dismiss that power that could be achieved through that. I also wanted to remind everyone that healthcare is a business. 35 years ago, the model of wellness and care for citizens changed. And now that's what we are confronting.
I have a lot of questions too. So I'm going to try to focus this more on policy and in firms and kind of industry-wide is something that I've noticed in past companies I've worked with. I've been on the architecture side, currently on the development side, is that when companies sponsor or cover things like IVF, IUI, is that it's done when the couple has fertility issues. It doesn't necessarily address the concern if you're a single woman trying to have a child. So has that been part of any of your company's discussions or industry discussions? And then second to that, when we talk about safety and autonomy, have any policies been updated to include egg freezing? For women, like a lot of women in our industry have been getting married later and choosing to have families later. And if you're talking about choice and safety, that type of coverage would make a lot of women that I know feel a lot safer as someone who's gone past that kind of realm. And yeah, have you guys discussed it within your companies?
I can say I know it is currently being discussed, both coverage for egg freezing and things like greater coverage and benefits around adoption. I know that it hasn't been enacted yet, but it's something that we're actively discussing. And like I said before, it's architecture is not the leading edge of these kind of ideas, but I know there are some firms out there that cover it. So I think it's something that should be brought up to leadership.
On the side of the Beverly Willis Architecture Foundation, this is definitely a topic that has been discussed in our roundtables. Again, leaders tend to attend, not only women. We do invite anyone that is interested in issues. And that's been brought up. And I think that this helps us focus our next steps into this topic to be more, zeroing into it. And as we are a conglomerate of people that practice in different places, that we cover construction, engineering, owners rep, you name it, there's some representative there. We should be able to try to impact more broadly and nationally these topics because, again, women are spearheading some of these efforts, but everyone needs to come along and we need to continue to pull everyone up with us.
Thank you. Great discussion here. It was great to hear everything. To the questions that came up about public health, generally and access, I'm a healthcare architect, so I work with a A&D firm, and this is like a part of our job. But I would like to say there are so many efforts going on in this city. I don't know if that's enough, but recently, we won recently a project where a private nonprofit actually gets a grant from New York State. It's a transformation grant. The budget might, not be great, but it's a grant to work on a center for sexual and reproductive center. I also know the NYC H&H, which is the public health system. They will usually work with organizations and file for lots of grants. During COVID, for instance, not related to women, but they were working on developing, and our firm actually developed 3 of the COVID centers in Brooklyn in neighborhoods where actually access is difficult to resolve that health disparity. So there's some work going on. I don't know how much is enough. but our tax money is sort of going there, and nonprofits want to do more and more to kind of, get more of these grants working. Just a comment here.
Thank you.
Hi, so you mentioned like with SOM being a global firm, I'm wondering if that broad of people living in countries with different policies, if that's impacted at all the discussion around providing health care and like different things for people in the US but also abroad, if maybe there were influences there, or if the changes made here influenced other countries?
It's a great question that I'm not 100% equipped to answer, but I know that our human resources operates kind of on a country by country basis. So the decisions that are made for the benefits really only apply to the US offices, and actually even each office has different policies based on what state it's located in, and that I think is mostly how larger firms operate. But it's something that the Women's Initiative has dealt with, and the different cultural contexts of the different offices. We were started in the New York office and basically have been starting chapters in the different offices. And when we started one in the Shanghai office, it was a very different kind of discussion, just because the cultural context there around women in the workplace was so different. But I think the perspective that they brought to our firm-wide discussions was really interesting, and I think made us more open to different ways that we could be advocates for women in the workplace in different kinds of places.
I can say sort of anecdotally too that I've had conversations with other folks working in large firms with international offices, and while true that their benefits or what's being provided exists within the country context, I think the conversation and the awareness is putting pressure, right? So in this case, there was a European office in France, and the country has different requirements.
Yeah, our London office is like suckers. No, not really. But they have much more extensive benefits with regard to reproductive care, just because it's provided already through the National Health Service there.
It's kind of like salary transparency, though. Like the first step is being able to sort of talk about like, hey, what benefits do you get, right? Also because of the nature of the workplace is shifting, and we're less and less tied maybe to a particular location, even though our legal rights are very tied to a location. We've got time for one more. I know there are more than that. This is such an incredible conversation.
This has been amazing. So the AIA has done a lot on the environmental side to push towards zero emissions by 2030, et cetera. Reproductive health is 100% wrapped up in our sustainability and global welfare, and it disproportionately, I really support what you were saying about policy, and I just want to point out specifically in New York, two things. One, could AIA be doing more for reproductive health in the way they are for the sustainability and environmental health? Because they are inextricably linked. Why isn't that part of it? And if it's not, can we make a new one and like really, really go towards that? Because I think you guys have so much power. The next thing I was going to say was that just in regards to economic disparity and political policy, that we are all very privileged to live in New York, those of us who do, in this room, and we are in a good place, but we are in a blue state that not all blues are created equal. And therefore, what you said about policy is 100% right, because it is getting dirty. And like, if there is Republican PAC money supporting Democratic candidates, we gotta extrapolate that and freaking vote against that, because blue is not good enough anymore. For women, it is not good enough anymore. We had Roe versus Wade. It was taken away from us, and it came right, with the ERA not being passed in the 60s or whatever, like immediately the right wing swang to like take rights away from women. So this is like, the personal is so political, and I think I just like gave you a big old sandwich of nothingness, but I'm very, very fired up by this conversation.
I think it's a good point you raise, particularly about sustainability, which again, it's sort of like, we know there is tension around climate change and how it's addressed on a national level. We are operating in a profession that generally has worked very hard to address sustainability through our codes, through the buildings we design. It's not very controversial. It's seen as benefit. You make your building LEED Platinum. It's beneficial for everybody. Why doesn't that carry through to other things, right? Why does, the equitable labor practices of building your building, why is that not in there? Why, there are so many things like this that I think you're speaking to, and we are in a moment where I think we're constantly waking up to the intersectionality of so many things. Thoughts on what we as architects, how we can address this?
Well, the good news is that there is an exhibition addressing that today, and I know anecdotally that there were some challenges in the past with finding venues to showcase it. Even last year when we had this talk that prefaces this one, it was a little bit of a challenge. There was a discussion about like, okay, is there gonna be people protesting about this outside of this venue? And again, we are in the West Village, we are in NYU. So we are in a very sheltered space, but there are still some questions about protection, safety, even here. So I think that, there's always, you can do more, but we're moving in a step in the right direction. There is an exhibition here. There will be more conversations around this. So thank you for pushing and moving the needle forward.
Well, I'm sad to cut off the conversation. We really are cutting it off. There were more hands, but I just want to thank our panel of guests, and of course, thank you, Center for Architecture, for hosting this, and thank you all for attending, and hopefully we can, keep the conversation moving in all of our professional and personal lives. So thank you, everyone. Great job.